gives me great pleasure to present Mike, who's just finishing Pillar 2, and he's going to talk about emergency medicine to health coaching. So it's quite a long journey, but it's very riveting to listen to. So I'm going to hand over to you now, Mike, and we'll sit back and listen.
Thank you, Mary. Let me just share my screen. Oh, good evening, everybody, or good afternoon, depending on where we are in the world, and maybe even some of us a good morning. My name's Mike, and it's both a privilege and an honor to spend this time with all of you. As I kind of look back at the journey of where I am to get to where I am today, and the route that I'm embarking on from a kind of almost like a life change management perspective after almost 40 years of emergency medicine, and to share the why of where I am there and why I am busy doing the health coaching course. And I must say that sharing this and preparing this presentation has been an emotional experience in terms of the journey that I've followed. And I'll be just reflecting and apologizing up front if I have to pause and just take a breath at the moment, because it is an intensely personal journey of how I got to where I am. And as it said in the blurb, part of the journey is me sharing not only story, but also insights and poetry, which has molded my thinking, which helps me to reflect back on where I am, where I was, and where I'm going to. So just to state up front as well, just so we know that all the views expressed today are my own personal views. They're not representative of HCA or any of its affiliates. And nothing that I might mention, even if it might sound like it is medical advice in any way. And I would encourage people that if you, in the listening and the journey and the process, that you reflect, if you take on, if you think further and deeper, that it draws you into the thinking process. I would encourage you, as I say, from just a personal medical and disclaimer point of view, to make sure that you avail yourself of any resources that you might need on reflection. I'm saying that just not as a trite comment, but merely that for myself, the journey was a deeply personal one to put the presentation together. So where does it all begin? Where do we begin moving into emergency medicine? So the path to emergency medicine, or the path to anything relating to that, is a fairly difficult and convoluted one for many people. And if you look at the top bar there, it says medical student. To the left, it says crazy. Beneath that, attention span non-existent. Those people gravitate towards emergency medicine. Some of you might be in medicine. If you are in medicine, it'll be interesting if you see, if you are in medicine, where you fall into this category in terms of your demeanor and so on. I know this is a fairly trite, but it's also kind of humorous as well. If you look at that and you are in medicine, some colleagues are in surgery, or colleagues are in pediatrics or anesthetics, you might find them suitably placed on this chart as where they are, or some of your medical colleagues, or if you've got friends who are in medicine, you might pick up some of their demeanor with this as well. And the short attention span in the bottom right-hand corner with the three wolves is pretty much what most of us in emergency medicine become or are. So just a humorous interlude to start the process as we dive deep into the journey that I've taken to get where I am today. My journey was slightly different. I started in pastoral. I was in pastoral care, studying bachelor theology, majoring in ethics and science and religion. And my idealistic journey from transitioning out of that space into emergency medicine was on the understanding that from trying to save the world to just saving one patient at a time, one person at a time. And even that journey in itself was a massive eye-opener for me, moving from that idealistic worldview into a fairly cold, hard reality of the grind of emergency medicine. So as with all things, everything begins with the first step, as they say. The journey of 1,000 miles begins with the first step. And the journey for me in emergency medicine began with the first step, relating to moving forward from my early days in the late 1980s, moving into where I am now. So I've been involved in emergency medicine, fire rescue, EMS, disaster management, and risk management around that for almost 40 years. I've worked in multiple roles all over Africa and the Middle East, and in total over 5 continents and 40 countries in the last 40 years. The last 25 years has been a lot of it embedded in the Middle East and in Africa, working in significant different role functions, relating to clinical governance, flight medicine, ICU medicine, critical care medicine, and remote site work, sometimes being out the country for long months, sometimes up to a year at a time, depending on the conditions of the environment that you're in, especially if you're looking at disaster and pandemic and epidemic medicine. The journey's continued along that line, and in the process, I've been able to be involved in a number of very interesting and exciting processes. Was the contributing editor-writer for Ambulance Today UK for 5 years. I worked through COVID in the Middle East, locked out the country for 15 months through multiple outbreaks in Saudi Arabia. And reflecting back on that, if any of you are familiar with the writings of Edgar Allan Poe and have ever read his book, The Masque of Red Death, that's pretty much what it was like, working through COVID in that space for that length of time. And it was just really grinding it out day by day, and just focusing on that was very, very stressful. And at the end of the outbreak, after being away for so long and being working flat out, pretty much every single wall and castle that we might have built around us or built with us was, despite our best efforts, was gone. And really reading that book and reflecting back on it again, it's no allegory. That was real life, and the effects that it had on so many: the infected, the cured, the untouched, the medical teams, everybody that I worked with. It was significant, life-changing, and life-ending for me. And further to that, I still work now as an external peer reviewer for the NIHR in the UK. And interestingly, they're doing quite a lot of interesting stuff in the health coaching space at the moment. I work for them as an external peer reviewer on Africa and emergency medicine across the LMIC region. And then I consult a number of companies in both the medical and the L&D space at the moment. But all of this has led me to the point where I am now in my journey, in my career, where I look back at medicine and my life significantly differently. Apologize for the typo there. Just noticed it now. But there's a lot that I've carried back with me and brought back with me through that. And part of that is the importance of critical thinking and evidence-based medicine. And I'll reflect as we move forward and get deeper into the presentation of the importance of evidence-based medicine and critical thinking, even in the health coaching space. So critical thinking has been the cornerstone of my practice, my approach to emergency medicine, and the way I teach emergency medicine as well. And that mnemonic algorithm on the left is, I use that as an introduction to when I teach trauma medicine and emergency medicine, which I still teach at an international trauma and life support faculty. And that is that we need to be able to think and reason and rational through our processes. Algorithms and guided processes do sometimes limit our thinking and our thought process. So that's important that we, for me as a person, as a practitioner, in no matter what space it is, be it emergency medicine or health coaching, that I continue to think critically, use my brain, look at evidence-based medicine, evidence-based practice, be it in emergency medicine or health coaching. And that for me is a very, very important process of where I am in transitioning and expanding the way I look at life in medicine. So the whole journey brings us full circle back to where we are. The journey of life is almost never ending. And in today's world where non-communicable diseases are surpassing communicable diseases, we must shift away from the way we treat patients and ourselves. For those who might not be as medically understanding of the NCDs and CDs, communicable diseases we view as infectious diseases, and we view a lot of those things as in HIV/AIDS pandemics that ravaged parts of the globe in the 70s and the 80s, and the spin-offs of that, and tuberculosis and the spin-offs of that, those led to significant increases in global mortality rate statistics. But now we're seeing that non-communicable diseases have pushed that right into the shadows. So what do we mean by non-communicable? So we're looking at cardiac disease, diabetes, obesity, hypertension. All of those are non-communicable diseases, and all of those are effectively lifestyle diseases. So I need to shift the focus of the way I treat patients and the way I manage patients, to focus on the before event and not so much the after. Emergency medicine focuses really on that critical cusp of just after a traumatic event, where we then intervene to try to make life-changing interventional processes. And we now need, for me, and I think globally there is a global shift, that we move towards preventative and primary before we look at emergency and palliative. And if we can drive the preventative primary, then we can pretty much reduce a lot of the emergency and even some of the palliative. We've noticed in significant areas of medicine that cardiac surgery can be delayed or even taken off the table. Patients with other diseases, hypertension, cardiac myopathy, skeletal joint issues, cannot need to go down the route of emergency care or corrective surgery if we focus on the preventative and the primary. And we focus on lifestyle changing medicine, which is really what health coaching is all about. So taking just a step back and a pause back to looking at the cusp of where I'm venturing and where I have been and where I'm working through, and reflecting back on emergency medicine. Those of us who are of the age where I am, the boomers, the baby boomer age, the Eagles in Hotel California will know that song very well. And one of the throwaway lines of the song is, you can check out anytime you like, but you can never leave. And that's really what emergency medicine is like. The memories, faces, successes, failures, they're there with us. Even though I'm not a full-time practitioner anymore, I'm still registered, I'm still licensed, I'm still involved in community medicine practice where I live. And the memories are always there. So one of the key things about emergency medicine is it has the ability to dehumanize and diminish or renew or expand our powers of feeling, our powers of emotive response, our powers of how we cope with what's around us. And as a practitioner, it's our choice to decide which of those paths we follow. And that choice that we make as a practitioner is critical because it changes the whole focus of the way we practice our medicine. And I would say, even looking at health coaching and the health coaching dynamic, it's fairly similar in the sense of that how we approach our patients, our clients. If we look at how we can approach them from an expanded powers, a renewed powers, an emotive response, an empathetic response, I think that would be a powerful approach in how we understand where we're looking at and how we're managing the patients who are coming to us to be guided and coached into a healthier phase of life. So, and then reflecting back on emergency medicine again, that one of the challenges one of the mental challenges, one of the emotional challenges that we face in working in this environment is that not everybody you treat lives. Many people die. Many people don't die despite our best efforts. And how we as practitioners, emergency medicine practitioners, deal with the pain of the defeat, which we sometimes do personally take on that death as a personal defeat, and how we need to focus on processing that pain and moving through that. So, but despite all of that, I still believe that the goal of any profession, and particularly the profession I am still in, emergency medicine, and the profession I'm moving into, health coaching, should be a living force in the quest for the prevention of human suffering. So be it from a health coach point of view or emergency medicine point of view, that's what we should be focusing on. We do need to reflect that sometimes that process can come at some stress and cost of our own mental health, particularly in the emergency medicine space, and I can reflect back on that intimately. So that is a challenge where we're dealing with these dynamics. I'm going to share one or two poems that I've written now, which have helped me understand and contextualize where I am. This particular poem here, it's called Trauma. I wrote it in 2018, going through some rough times in medicine at that stage. I'll read the poem. As the blood dries beneath my nails, as the metallic smell lingers in the air, as my boots slip on the shit-stained floor, as I wipe the vomit from my shirt front, removing blood-stained glasses, ripping off blue blood gloves, gazing across at what lies before. Not a beep can be heard. Lights fade to grey, ashen faces stare back, and the memory remains. And that's really what it is. The memories, no matter how much therapy we go for, and I have been in and out of therapy in my time, no matter how honest we are with ourselves, we'll always deal with those memories. And the truth and the matter is to deal with them truthfully, empathetically, and in a caring way. So that's important for us, even moving into where we are in the health coaching space. So that's for me, that was a moment when I was going through quite a lot in working with some really critical patients. The next poem I want to share, it's too long. It was too long to roll and to scroll on a credit line. And I'm quite proud of this poem in the sense of it was chosen by a poetry journal as their poem for the month. And it's called God is in Session. I reflected about this poem when I was chatting to Mary about the presentation. And that is that often, well, no, I wouldn't say often, I would say in many cases, people who work in emergency medicine do have a slight God complex. And because in that moment, the patient's life is in our hands. And at that moment, the decision and the decisions we make are critical in that space. So for me, my writing, be it my poetry writing or my critical thinking writing or the articles that I posted in journals, is for me, it's a cathartic, healing, personal, confrontational way of seeking closure. Not always, there's never full closure. So this particular poem, it's called God is in Session. Wailing, screaming sirens tear the night apart. Screeching, burnt rubber scar the asphalt. As you deeply inhale and sigh, carbon, rubber, and sweat attack your senses. Hands on the spinning steering wheel, thinking, planning, expecting the unexpected. No plan survives initial contact. Grabbing, rushing, pushing, jostling, questions, answers, sobbing, screaming, crying, silence. Gloved hands palpate, poke, prod, ears listen, eyes roam, instructions issued. God's creating, and it will be good. Skin exposed, clothes cut, working in blood and flesh are God's tools. Needles puncture, flashbacks appear and reappear. Machines beep fast, then faster, fluids chase in. Smells assail your senses. Burnt metal, blood, vomit, you drive them down. Sweat drips off God, mixing with blood. God is in session. Angels hover. Pressure applied and present. Vials crack, needles puncture skin. Beep, beep, beep. Slower and slower. Vocal cords visualize. The bag of life is squeezed continuously. Rhythm of life is kept in balance. A refractory pause ensues. Gloves changed, sweaty brows mopped, spectacles wiped clean of sweat. Decisions, discussions, decisions. Beeping changes. Angels move closer. God intervenes, shoves them rudely aside. Not today, God says. Not on my watch. So poetry, not only the writing thereof, but the reading also attracts me. And when I was stuck out in COVID, I spent quite a bit of time, strangely enough, reading the writings of Dante Alighieri, Divine Comedy. And in this particular poem, I reflect that on because it was quite a rough time for me. So, and as Dante writes, midway along the journey of life, I woke to find myself in a dark wood, for I had wandered off a straight path. How hard it is to tell what it was like, this wood of wilderness, savage and stubborn. The thought of it brings back all my old fears, a bitter place. Death could scarce be bitterer. But if I would show the good that would come of it, I must talk of things other than good. So I choose to view this as a positive poem because I choose that no matter how bitter, maudlin, depressing, and challenging the journey has been in emergency medicine, even stimulating, I must focus on the good that's come out of it, both personally and professionally. And that good will be my guiding star. And my approach to health coaching is with the same approach and the same passion and the same intensity of how I map and mold my thinking. So the thoughts that I take with me from emergency medicine into health coaching, as a thoughtful, science-based practitioner who strives to be iconoclastic and strives to adopt a questioning, reflective approach, my health coaching approach is similar. And when looking at new and challenging concepts and modalities, I focus on evidence-based medicine. I focus on the source of the medicine, the source of the evidence, and also if there's perceived bias, mine in the reading of what I want to read or want to hear, or is the writer who's postulating evidence if there's a bias in the writer. So that's what I carry with me. So, and in treating patients well, I've learned to put my bias at the door, and in coaching would be no different. Whatever bias I might have or might not have, when working with somebody, that bias stays at the door, and the patient, the client, the coachee is the person who takes center stage and not my bias. And interestingly enough, the National Institute of Health Research in the UK is running a number of interesting funded studies at the moment in health coaching. And there's a lot of research going into health coaching at the moment in a number of sectors. In South Africa as well, a couple of the large medical insurances and medical insurance companies are moving aggressively into the health coaching space. Preventative medicine is key, and I'll come back to a comment that somebody made earlier about preventative medicine and big pharma, and we can have a discussion about that at the end of this. So those are important elements that I bring with me when I embark on this. Further thoughts and understanding is Karl von Clausewitz, a Prussian general and well-known military theorist. He writes that any complex activity, if it's to be carried out with any degree of virtuosity, calls for appropriate gifts of intellect and temperament. So when we're dealing with our patients, our coachees, we are dealing with complex activities with them. We need to bring that virtuosity, that intellect, that temperament, all that vests on that we need to do, and bringing in the thinking of Nancy Klein, because everything we do depends for its quality on the thinking we do first, on our planning, on what we bring in our virtuosity. It all vests in that of how we practice. And ponder on that thinking for yourself is still a radical act. And that is a comment that comes out of Nancy Klein's book as well. And far too often we've moved away from critical thinking, and we need to be in that space. We need to take our patients into a space where they can think for themselves and allow them to. And that's the process of health coaching, allowing them to find the solutions which they already know, which is in part of the lessons I've learned along the way in emergency medicine and in dealing with myself and patients and colleagues and processes and situations. And the importance of silence, the solace in the silence. Silence echoes around the enclosed walls of our minds, encouraging us to break down the alienation, finding solace in silence and the importance of being silent, and using solitude as a process of mindfulness and processing. Are powerful moments that we can have with our coachees, with our clients, with our patients. And I don't know if any of you are fans of Leonard Cohen, the songwriter and the poet. And he was very much into into Zen Buddhism as well. And in one of his books, the Book of Longing, he speaks a lot about stillness and the art of stillness. And there's another writer, Pico Iver, who wrote about Leonard Cohen as well. And he spent time with Leonard Cohen in the monastery for 5 years. And Leonard Cohen's nickname was Jikan, which is literally means the silence between two thoughts. And for us, that should be a profound, powerful thought to ponder on. That there is the silence between thoughts generates further critical, deeper thinking. And the beauty and the challenges of the solitude and the silence are critical for us to process and unpack and understand. And for me, I find them very useful and I find my space to have those moments. A political commentator that I follow and read, he wrote a book about it, and he says that we're living in an attention deficit era. And our attention has become the most valuable commodity and the most exploited. And in the area where we work, where we are giving people attention and allowing people to be in an attention-rich environment, is an incredibly privileged space. And that should give us a moment to reflect on how we think about what we're doing and think about our process. And it gives me huge pause for thought when I think about things like that. As a person, as an individual, not even as a practitioner, not even as a health coach. I've also learned over time in emergency medicine to manage my anger. Some people might be surprised that I might have an anger management that I've had to, but yes, sometimes I have been known to get angry. And the way people have helped me deal with that is also helped me to deal with that as well. So, and that's helped me to come to a better understanding of my own emotional space. And often my anger has come out of that I haven't been able to manage my own personal pain, emotional fatigue, and vicarious trauma. And that for me has been critical to along the path and the journey that I'm taking. And another one of the lessons I've also learned is asking the right questions. And yeah, I'm going to have a bit of a side comment that some people might think is kind of unusual. That asking the right questions is critically important in a health space. And I think one of the challenges in the mainstream medical space is that the general practitioner is not given the time to ask the right questions. In the NHS, they have 10 to 15 minutes to consult a patient. And even in the GP practices here in South Africa, in private practice, they have 15, 20 minutes consults. You can't ask the right questions. If you go to spend time, and if you book a 30-minute consult with a GP and you sit with them, in most cases, if you're working with a good general practitioner, a good doctor, they can ask you questions, not even touching you at all or doing any diagnostic work, but by asking the right questions, they will be able to very closely get to definitive diagnosis if they have the time to ask the right questions. And we as health coaches are even more privileged because we are in a space where we can ask the right questions within the coaching framework that we've got and have the time to spend with the coachee or the patient or the client. To ask the right questions, to listen, and to spend time with them. And I just so wish that normal medical, formal, mainstream medical structures would go back to that, to allow the doctor to be given the opportunity to ask the right questions and to have the time to ask the right questions. And I think that is critical for us to just pause and reflect and think about. So diving now into just some more understandings in terms of why I get excited about health coaching, why I get excited about being in a health coaching space where evidence-based medicine and evidence-based practice, EBM and EBP, are put on the table. So within the NIH, various documents have been written about the importance of lifestyle health coaching. And it's been proven that lifestyle health coaching is an important component, an important part of the armory of medicine, that it needs to be there as part of the global war against potentially preventable, non-communicable chronic diseases. We need to do that. And that's critical. And that's one of the reasons why I chose the HCA, because they are closely aligned with UKIHC. They are closely aligned with them. They follow their core content. And vested in that is the fact that they are cross-referencing evidence-based medicine practitioner phraseology and documents in their own documentation as well. And that was why I ended up with HCA, because that they are pro-EBM and pro-science and pro-clinical thinking and critical thinking about how we can attack this. And in Pillar 2, the Ornish plan was mentioned as well. And Dr. Dean Ornish, I've been a follower of his since the late 1990s. And his 4-part plan of lifestyle changing medicine, which was not using any medicine, was able to take, on average, elective, corrective cardiac surgery off the table between 40 to 60% of patients within a 6 to 8 week period of them following his plan. And the published work that he did in peer-reviewed journals and the basis of his program for reversing heart disease in 1993 became the first non-surgical, non-pharmaceutical therapy for heart disease to qualify for insurance reimbursement in the US. So big pharma is behind it, and medical insurance companies are behind it as well, because they understand and see the need for it. And that for me is critical, that this ideology, this thinking is embedded within the curriculum that we're working on. Evidence-based medicine for me is critical. And the higher the level of EBM that we can attain in terms of how we're managing and working with our coaches, our clients, our patients, for me is critical. And very important for me as a person who spent the last 40 years focusing on science and evidence and how we manage critically injured medical patients in the pre-hospital emergency setting, to now bring that back into this space, into a place for me of comfort where I can still sit comfortably on EBM and still read research documents and understand them and reflect on them and bring them into the health coaching space as well. So, and for me, if I want to make a significant clinical difference in the space I'm moving into now, this for me would be the way I would move forward into this, and even into a research-based space with the NIHR, and expand my external peer reviewer role with them into maybe more of an embedded role, and dragging HCA into that as well, because that's important that we make sure that we focusing on best evidence, best clients, best practice, best. So is EBM the same as functional medicine? No, it's actually not. There's a not so subtle difference around that, but Samina, but we can chat about it later as well. Mia, it was Dr. Dean Ornish. So, and I think it's important that we also understand that our code of conduct, our code of practice, and our legal liability under UK IHCA and HCA and the codes are all intertwined and are all evolving around the same place. And for me, that's important, having a code of practice, a code of conduct, and a legal liability framework within which we can operate. And I just want to, just as a cautionary, I believe in reading the small print, and I would encourage those of us who've taken out our medical insurance liability already to read the small print in terms of what it covers and doesn't cover. And it's important that you understand that if you work outside your scope, your malpractice insurance, liability insurance doesn't cover you. So it's important that we have a good understanding of that. I mean, I've had liability and malpractice insurance for years, but now I've also got a separate one for health coaching, because that falls under a different ambit and a different scope and a different code of conduct. So it's important that we as practitioners understand that. But I'm also enthused by the fact that UK IHCA and HCA do a lot of ongoing CPD, continued professional development, and move forward the whole time to have rollout discussions, rollout gatherings, rollout meetings to keep people up to date. And for me, that's very important that we can focus on that the whole time. Yeah. So coming on to the why, as we move into the last couple of steps of this marathon, as I've said, EBM and EBP for me, BP for me are important. And for me, that gives me comfort. It gives me pause for thought that as I help patients navigate their way into a new, healthier way of living and interacting with the world, I can relate to that as an individual on a broader context as well, to a gentler way of living. So it's not only you are what you eat, but it's how we interact with each other and the planet. I mean, a diet is just a diet. They're just fads. But living healthily, mentally, physically, and emotionally is a way of life. And I'm going to have a bit of a dig here, if I may, which I will. I've got the floor at the moment. I mean, the flavor of the month and the discussion of the month at the moment is things like GLP-1 and Ozempic. And that's just a tablet. It's like a diet. It doesn't actually do anything. You can't stay on those things indefinitely. And we also need to bear in mind, within the South Africa healthcare space, Ozempic is not approved for anything other than diabetes. Used outside of that, it's in contravention of its license. And if it's used outside of that and dispensed outside of that, it's in breach of SAPRA regulations and guidelines, and in fact of the guidelines of the practitioner who's dispensing it, anything other than diabetes. So we need to, us as health coaches, need to be sitting on the cutting edge of where we are. We need to focus on a way of life, not just a diet for the next 6 weeks so they can get into their wedding dress or their wedding suit, or because they're seeing the family or something. But it should be a way of life. And a way of life is encompassing everything. around us, minimal impact on the world around us. And part of the why around that is also the perspective in terms of where I am positioned now and where I plan to move into a coaching space early next year when I, fingers crossed, cross the line and qualify in January, and embark on that on a healthier lifestyle approach to everything in terms of the project that I'm running on the farm where I live, which is a way of life in terms of what we eat, how we live, how we exercise, how we de-stress, how we find time for quiet, how we find time for solitude, and how we find time to spend time with the people who we want to spend time with. So in closing, the perspective is, we're guiding people. We don't have to know the whole journey, but we've got a good map. And on the way, we'll learn. And I trust that the learning process I'm going on will enable me to have a clearer map, more clarity, and assist me in cementing more of what I know as a stronger foundation to walk confidently with others on this pathway. So join me. Let's learn, build a stronger framework as we all move forward together. And for me, 40 years in emergency medicine, I'm still learning, I'm still working on myself. And this journey now is a continuation of that, to keep working on myself. To close out, I'll close out on a poem called The Medic's Epitaph, which has been what I've focused on over the years. Looking back, I gaze at a red and broken past. Around my feet lies the present, an uncertain yet clear future lies before. Surrounded by pain, time spent with the dead and the dying, understanding death at times comes easier than conversing with the living. Contemplation brings a deeper appreciation of life. All I want my epitaph to be is not confusion, but just trying to leave someone alive. And that person being kept alive doesn't have to be the patient. It could be yourself, me. It could be you. It could be your colleague. It could be the person next to you. Thank you for your time, and thank you for this privilege and this opportunity. And I'll try to scan through the questions and answer. And if there's any other questions we can, I'll stop sharing the screen now. Thank you.
So Mike, that was a privilege actually to hear you speaking from all your experience and particularly sharing those 3 poems. I mean, that I shall never forget this presentation because of those poems, particularly God is in session. That really gets inside you. Angels hover, angels move closer, not on my watch. That's extraordinary. So tell me, Mike, how do you feel now that you've done that presentation to your peers and shared it in this wonderful space?
Well, I mean, it is I feel privileged to have the opportunity to share, and I feel privileged to be able to, without wanting to sound, I don't want to come across arrogant or whatever, but I feel privileged to be given the opportunity to be able to share so much reflection of how I feel we can be as a health coach. Because that's what this is all about for me. I'm doing it for many reasons, but just to be a better person for the person who needs me to be there for them.